Breathing is one of my favorite ways to manage any pelvic floor symptoms, weakness in your pelvic floor muscles, tightness in your pelvic floor muscles, any pelvic floor muscle issues. Breathing is the key, it's the basic. So, if you can learn proper breathing technique, you can manage a lot of your pelvic floor muscle issues. There are different ways of breathing. The breathing I'm talking about here in this video is 360 breathing. So there are three main steps to diaphragmatic 360-degree breathing. First thing is that we need to relax, melt the muscles, the pelvic floor muscles, these muscles at the bottom of our pelvis, the muscles around our anal canal, muscles around our vaginal canal, and the muscles around our belly in the front, the muscles in the back, the muscles on the side, our ribs. So the first step is to connect to these muscles and relax them. You don't want a clenched muscle anywhere in your abdomen, in your pelvis. So make sure you're not clenched, you relax those muscles, and once you are able to relax those muscles, now you can breathe into it. Once you have relaxed those muscles, you're going to breathe into it to open it up like a balloon or like this. And as you breathe out, it's going to recoil back to its relaxed resting state. So the first step is connecting with your muscles. Make sure they are not clenched or tight. You're going to breathe into your back. You're going to open up your back like a spring opens up. All that the spinal canal is kind of going to open up slightly. Your belly is going to rise a little bit. Your ribs from the side are going to rise a little bit, and your pelvic floor is going to go down, stretch out, like when you jump on a trampoline. Trampoline goes down. So it's going to look something like this. The pelvic floor here, the belly here, the back here, the side ribs are here. As you breathe in, it's going to open up. So keep them nice and relaxed so they can open up. If you keep them tight and clenched, they are not going to be able to open. So open it up as you breathe in, and as you breathe out, they're gonna recoil back. So breathe in, breathe out. I like to breathe in through my nose and breathe out through my pursed lips, like. So breathe in, breathe out. The first step is really important, because if you're tight, no matter how much you try to breathe in, it's not going to open up. So relax and breathe in and breathe out. Most pelvic floor patients, because of their pain, because of their experience incontinence, we learn to keep our muscles clenched, keep it clenched and protected all the time, because we are fearful of pain, or we are fearful of leaking urine or feces. So we keep them tight all the time, we keep them clenched. So so because of that, we become only chest breathers to prevent it from any movement, and because of that we get tightness and all those issues get worse. We want these muscles on your back, in your abdomen, or the sides and pelvic floor, we want them to always keep moving in a nice opening and closing in this manner. So it improves their blood supply, it improves their relaxation, it improves their strength and coordination. So if we start ignoring this area and keep it clenched and tight and only breathe into our chest, it stays tight and weak and does not work when we need it. So breathing helps to give it a normal massage. It helps to contract it as we breathe out, and it improves the circulation as it's always opening up, closing, stretching, closing. So breathing is the key. So when I see my patients, I work quite extensively on breathing. You can first start in side lying, because when you're on your side, your back is open to move, your pelvic floor has room to move, your belly has room to move, so it gives you a little bit more room to open up and close. So I always start with side lying, then we can go in on your back lying with your knees bent, and then we can do it sitting, then we can do it standing, then we can coordinate into our activities while we're working out, while we're running, while we're vacuuming, when we're lifting, opening, closing heavy door, pushing, pulling. So we coordinate all that into our day-to-day activities to prevent issues like incontinence, pain, the feeling of heaviness or bulging, etc. So breathing is very, very important.